This presentation will be about drug and alcohol awareness. My name is Liliana Felix, and I'm a student at Aspen University, and this is for my Community Health 2 class. I'm going to start this presentation by providing some statistics, and this is more tailored for high school and middle school students. So according to the National Center for Drug Abuse Statistics, substance use is a rising issue, especially in the teenage population. 61% is how much drug use went up among 8th graders between 2016 and 2020. 62% of teenagers in 12th grade have abused alcohol, and 50% of teenagers have misused a drug at least once. Objectives for this presentation are to define the problem, describe how drug use may affect your life. I'm going to provide some long-term and short-term effects, as well as preventative measures and resources. Definition of the problem. Being a teenager comes with many challenges. I was a teenager not too long ago, and I realized that you're introduced to new stressors, whether that is having to have a job, having a lot of homework, maybe if you're involved in a sport or an extracurricular activity, having increased pressure from family and peers to not only do well in school and in your homework, but also in that extracurricular activity. That can be really stressful. Additionally, having peer pressure from friends and classmates and being unable to find healthy coping mechanisms. Another big challenge is issues with family, whether that is maybe financial, family dynamics, not having support in your family. Those are all challenges that may cause a lot of stress in the teenage years. And then lastly, just wanting to feel accepted. I know that at this age, you just want to fit in. You kind of want to do what everyone else is doing, or just have that extra peer pressure to try drugs and alcohol. And when these challenges occur, when all of these that I listed, some teenagers do cave in and begin using drugs and alcohol. So here are some drugs and their effects to the body. Cocaine has an increased risk of heart attack, stroke, and seizures. Marijuana, there's a risk of impairment to your memory, learning, problem solving, and concentration, as well as a risk of psychosis associated with early and frequent use. So this can lead to schizophrenia, hallucination, and paranoia. Nicotine, this includes e-cigarettes and vapes. Using nicotine has a risk for nicotine addiction, as well as a risk for damage to your lungs. I could make a whole other presentation about the effects of nicotine and how commonly it is being used nowadays, especially in the teenage population. I am now in my 20s and know several people who began using nicotine, these e-cigarettes that at the time they thought were harmful or harmless, and began using it all the time, and now they're addicted to nicotine. They have lung damage, and it's just a habit that should not be formed, and it's something that is very dangerous. So moving on to the next one, methamphetamine. This drug has a risk of psychotic, uncontrolled behaviors and brain damage. Opioids, there's risk of respiratory distress or death from overdose. A big one is fentanyl. This one is a leading cause of overdoses. A lot of people are becoming homeless, or homeless people are using it and overdosing from it. This is why it's also important to carry Narcan. If you ever see anyone that's overdosed from a drug like this, you could save a life from carrying Narcan with you. But opioid is another dangerous one. With the teenage population, sometimes people have surgeries and are prescribed opioids, such as hydrocodone, oxycodone, other pain medications, and you can become addicted to them if you don't use them as prescribed and only when necessary. So another one is psychedelics. This can be like LSD, mushrooms, or any other psychedelics. This drug may lead to altered perception of reality that comes with hallucinations, which may be frightening to experience, and some short-term side effects of psychedelics can include paranoia and psychosis. Alcohol effects. Some short-term effects of alcohol are poor judgment, impaired coordination, changes in mood and behavior, alcohol poisoning, weakened immune system. All of these can lead to like severe car accidents if you try to drive when you're under the influence of alcohol. This can lead to violence, just many issues if you're using alcohol, and especially underage, using it without supervision or abusing it, using way more than you should. These are all issues that are short term. Long term issues are risk of heart issues such as high blood pressure, heart disease, and stroke. Risk of cancer, this can include head and neck, esophageal, liver, breast, and colorectal. Risk of pancreatitis, and risk of severe liver damage. Prevention measures. It is most important to talk to a trusted adult and let them know either if you are thinking about trying anything or you are currently using and want to seek help on how to quit. Have some resources. Just talk to a trusted adult. This can be a school nurse, this can be a parent, this can be, a guidance counselor at your school, or anybody that you trust. That most of the time teenagers don't seek out help because they're scared of getting in trouble or they're scared of consequences, but I guarantee that if you seek out to somebody and you let them know that you want to change this behavior or you want more information, and a trusted adult will be willing to sit down and talk to you. Then before trying anything, just research its effects on your body. Think about short-term and long-term consequences. I think just going and doing research in itself is enough for you to make you think and really reconsider if this is something that you want to do. Anytime I've done any research about the effects of any drug or anything on my body, I just think it's not worth it. In the moment, you may feel some kind of, you may feel either like euphoria or some kind, whatever you're trying to find with that drug, but in the end, it's just not worth it due to the effects it can have on your body. Find healthy coping mechanisms. There's support groups, there's therapy, also healthy friendships and surrounding yourselves with positive influences. Physical exercise is another good one, and finding new hobbies. Like you can try meditation, you can try just other ways to deal with stress, maybe going on walks, just finding other things that you can rely on to help you deal with all of the new stressors that you're introduced to in the teenage years. And then for alcohol as well, waiting until you're 21 and can responsibly buy alcohol and consume alcohol and do it just, socially or occasionally or not at all, but just do it in a responsible way. That is what's recommended for alcohol. Just wait until you're old enough and make sure that you do it in moderation if you are going to do it. And then some resources. The Kelty Mental Health Resource Center. These are all just websites that you can go on. This first one, the Kelty Mental Health Resource Center, it just provides some in-depth information on various substances and steps to seek help. The National Council on Alcohol and Drug Dependence, it provides support to those who need assistance. Confronting Alcoholism and Drug Dependence. This National Institute of Drug Abuse and Alcoholism is another great resource for alcohol abuse and alcoholism. And then lastly, NIDA for Teens. This provides knowledge and resources, including easy to read guides about various drugs. And then some support groups are Alcoholics Anonymous and Narcotics Anonymous. If you go on their websites, they can help you find meetings near you and resources to help you with either narcotic addiction or alcohol addiction. And then, like I said, another just very important resource is just to seek out a trusted adult and have them help you as well. So that's all I have for today. These are my references. They're mostly from the CDC